there is a simple routine of just 10 minutes a day that can help lower blood pressure naturally in older adults. And the most interesting thing is that it doesn't involve sweating, doesn't require a radical diet, and doesn't ask you to buy anything new. I am EDU Rodriguez, a pharmacist, biochemist, and health educator here on the EDU Health Tips channel. And today I will show you exactly the 10-minute routine that I teach to many people I attend, how it can help reduce pressure at various points over time, and why it works so well, especially after 60 years of age. Stay with me until the end because, in addition to explaining each step calmly, I will show you how to turn this into a daily habit, one that really sticks to your routine and makes a real difference. Before anything else, it is important to understand one of the main silent causes of high blood pressure as we age. Many people walk, try to eat better, and still see their numbers remain high. One of the reasons for this is the stiffness of the arteries. Imagine a garden hose. When it is cold, hard, or bent, the water pressure rises quickly. But when it is warm, flexible, and open, the water flows with less resistance, even with the same volume. The arteries in our body work in a similar way. As the years go by, they tend to lose elasticity. This forces the heart to work harder to push the blood, primarily increasing the top number of the blood pressure. So the question is simple. What is the fastest and safest way to help these arteries become more relaxed and flexible throughout the day? One of the most interesting answers comes from exercises called isometric exercises. These are exercises where the muscle is contracted but without movement. Several studies show that this type of effort can be very effective in helping to reduce pressure, sometimes even more than a light walk, especially in people over 60 years old. When you hold a contraction, the body receives an intense signal. During that effort, the pressure may even rise a little. But when you relax, the blood vessels dilate more than before. Over time, this teaches the vascular system to stay looser throughout the day. It's like training the arteries not to become so rigid. Two simple exercises come in here. One of them is the wall squat. You lean your back against the wall, slowly lower yourself until your legs are bent in a position that is challenging but comfortable. It doesn't have to be perfect, nor does it need to form that exact angle. The important thing is to feel the muscles working without pain. Start by holding for 20 or 30 seconds and, gradually, over the days, increase until you reach 2 minutes. If you have knee pain, arthritis, or insecurity with balance, start higher on the wall. The focus is on consistency, not suffering. The other exercise is the plank. It can be the traditional one on the floor, supporting your forearms and feet, or the version with your knees. If going to the floor is difficult, you can support yourself on a bench, a sturdy table, or even on the back of a sofa. Again, start with 20 or 30 seconds and progress to 2 minutes. The plank is great because, in addition to helping with pressure, it strengthens the abdomen, protects the spine, improves posture and balance, things that become increasingly important as the years go by. Within those total 10 minutes of the routine, the idea is to accumulate about 6 minutes of isometric effort. It can be 2 minutes leaning against the wall, 2 minutes in a plank, and another 2 minutes back against the wall, or reverse the order. If these exercises are not possible at the moment, you can use other static contractions, such as holding a half squat in place or squeezing a ball or a hand grip with your hand. The essential thing is to keep the muscles under tension without movement for those 6 minutes in total. Now comes a part that many people ignore, but which is extremely powerful. After working the muscles and helping to loosen the arteries, the next step is to calm the nervous system. Many people live in a state of alert all the time, even while sitting on the couch. The body continues to react as if it is under threat. This is controlled by the stress system. There is another side of the nervous system that acts as a natural brake, helping to lower the heart rate, relax the vessels, and reduce stress hormones. This brake is activated by a very important nerve. One of the quickest ways to stimulate this mechanism is with a specific breathing pattern. I teach something very simple: 6 breaths per minute. For this, you inhale through the nose counting to 5 seconds and exhale through the mouth counting to 5 seconds. That's it. Inhale 5, exhale 5. If you do this continuously, it results in 6 cycles in a minute. During this part, sit in a comfortable chair or on the sofa with your back supported. Close your eyes to reduce surrounding stimuli. Focus only on the air coming in and out. If your mind starts to wander, gently bring it back to your breath. This step lasts about 2 minutes within the routine. As the years go by, this relaxation system tends to become less efficient, while the stress system remains active for longer. This breathing helps restore balance, improves communication between the heart and brain, and sends a clear message to the body that it is okay to relax. Many people notice the pressure drop right after this practice, especially when done every day. And now comes the last part of these 10 minutes, which is perhaps the easiest of all: hydration. Many people walk around dehydrated without realizing it. When the body has little liquid, the blood volume drops slightly, and to compensate, the blood vessels constrict. This causes the pressure to rise. However, the person does not feel intense thirst, so they think everything is normal. Here, the idea is to drink about a large glass of water, something between 300 and 500 milliliters, over 2 minutes, in small and steady sips. Sit comfortably. Pay attention to the act of drinking. These slow sips also help reinforce that state of calm created by breathing. Putting it all together, what does this daily routine look like? In the first 6 minutes, you do isometric exercises, alternating between the wall and plank or another option that works for you. From the 6th to the 8th minute, controlled breathing comes in. 5 seconds inhaling through the nose and 5 exhaling through the mouth. From the 8th to the 10th minute, slow and conscious hydration. It's just 10 minutes of your day. 10 minutes. If you do this daily, with intention, especially the breathing and the water, the chances of seeing your blood pressure improve over the weeks are very high. Now let me ask you something. Do you already do some kind of exercise every day, or is your routine pretty stagnant? Comment below, because I like to know what the reality is like for those who follow the channel. If this content is helping you, go ahead and subscribe to EDU Health Tips, turn on notifications, and leave a like. This helps the video reach more people who need this information. Creating a new habit is not easy, I know. That's why some strategies help a lot. One of them is to fit this routine in with something you already do every day. It can be right after brushing your teeth, after breakfast, or when taking your medications. Another thing is to mark on the calendar or in a notebook the days you did it. This creates a desire not to break the sequence. If 10 minutes seems too much at first, start with 5. The important thing is consistency, not perfection. And if you can do it with someone in the house, even better, because one encourages the other. I always emphasize here on the channel that these strategies do not replace medical supervision. They serve as natural support for healthcare. If your blood pressure is high, talk to your trusted professional, continue monitoring, and use these tools to strengthen your body on a daily basis. Share this video with someone in your family who is worried about high blood pressure. Sometimes, a simple routine like this changes how a person feels throughout the day. In the next video, I will talk about some nutrients and habits that also help a lot with this control, so stay tuned here on the channel. I am Edu Rodriguez. This is EDU Health Tips, and my mission is to help you take care of your body in a practical, clear, and science-based way. Let me know in the comments if you will try this routine starting today. A big hug, and see you in the next video.